Okay, hello, hi everyone. Thanks for coming today to our online open day. Before we get started, I'm just going to do a few technical checks to make sure you can hear and see us all okay. So if you could just press the raise hand button at the bottom of your screen if you can hear me. Okay, brilliant. Thank you, everyone. Great, and I'm just going to lower those. And if you could just raise it again, if you can see our presentation and you can see my video at the side. Great, brilliant. Thank you, everyone. That's great. Okay, so a couple of things just to let you know. If you want to get in touch with us and ask, we've got lots of teachers here today in this session. So if you've got any questions that you want to know about studying at Newvic, or questions about courses, anything that you have, if you use the Q&A button at the bottom of the screen to chat with us, that's the button that you need to use. The chat function is disabled for this session. So if you click the Q&A button at the bottom and just write your questions in, it will come through to our teachers, and they will be able to respond on that throughout the session. So please use that at any point throughout the session and they'll be there sort of chatting back to you. Yep, so that's that. Another notice just to let you know, so this session is about NHS career pathways. So we're going to be talking about careers within this session. If you want to find out more about more in-depth information about sort of the courses and course overview, we've got lots of videos on our website on the Open Day page. So if you want to find out more about specifics about courses, you can go onto the website to have a look at those. So now I'm going to hand over to Asha, who's going to talk to you more about NHS career pathways. Thanks, Asha.
Hello, everybody. Welcome to our open day. Right, so basically, why study at Newvic? Plenty of reasons. First and foremost, I just say speak to our current and former students, and I think it will speak for itself. It's excellent, absolutely excellent. We are outstanding for our student well-being. Teaching itself is done by, every subject is done by experts in the field. We support and cater for our students individually. So for their needs, their study needs, their career needs. So yeah, and also we've got enrichment. So it's just all about academia, pastoral care, sports, hobbies, just a whole wide range of support for you, for what you need, really. Yeah. Okay, so entry requirements, basically A-levels. Please do look at our prospectus, because each course have different requirements. Minimum, it says 5 GCSEs grades 9 to 5. That does include English and maths. Some A-level courses, because they are more challenging, we do require 6s, English, maths and science. Okay, and then for T-levels, we haven't started offering yet. For applied science, 5s is what we require, so 5 in English, maths and science. And then for vocational level 2, 4s is what we're looking for in the GCSEs. Okay, so T-levels, it's something we haven't introduced just yet, but it's in the it will be coming up soon. Thank you.
So yeah, we have two T-level courses that we're running next year. So it's the childcare health and education course, and the construction design, survey and planning. So it's just the 2 T-level courses that we're starting in September. But yeah, Asha's right, we haven't started the science ones yet, but they will be coming soon. Okay.
Right, so these are just some study options that you could choose. Very popular, the first, you can see the first column there, biology, chemistry, psychology. And it's just option routes. I can't see the bottom actually, what that goes on to. But they're all sort of different science careers. Can anyone see the bottom of the screen? What does it say at the bottom?
So number 1, it's nutrition, as you see in nutrition.
Nutrition.
Yeah, number 2, it says there's an oral and sciences, nursing. So yeah, this is just an idea of some of
It's just,
some
options that you could
health
go for.
professionals.
That's correct, yeah. So if you see here at number 4, what you could do is 2 A-level psychology, biology. It's quite popular doing this. And then maybe a vocational health and social care course as well, which would take you into very similar routes career-wise as well. And then I think the next slide shows more options also. Yeah, so psychology, sociology, biology. And then number 2, very clinical medicine. It's very, very popular, biology, chemistry and maths. The option 2 and 3. So you've got other subjects allied to the medical field. We have a huge taking for that actually. Yeah. And then nursing also popular, as we said. Yeah. Okay, so these are the master classes. So we've got our whole science team here who can guide you through and sort of advise different career pathways that we could take. And we have had our past former students studying with us and going into these fields. So yeah, it's just a bit of guidance and advice, I suppose. So first person, I believe the first masterclass or the first career option is audiologist, and that's Henry. Would you like to take over, Henry? I think you're on mute, Henry. Can't hear you.
Hi, all. Good morning and welcome to Open Day 2021. My name is Henry, a member of the science team at New Vic. There are many pathways you could get to on the NHS system. But one thing you have to be aware of is understanding what your choices are. Like Asha rightly said, there are general entry requirements for individual courses coming to New Vic. But I just want to try and make some interesting points about the career or the profession audiologist. What you do as an audiologist is you identify, assess, and try and treat hearing imbalances and loss in patients. It's a very, very competitive profession. Usually the pathway is via the NHS training program. I would say that here at New Vic, you can go through the A-level study course, or you could go through the vocational, which is the BTech, which we offer here. Of interest to me would be you will be greeted and met by very professional teachers, people who are specialists in their various fields, and who will be able to guide you through your 2-year program here at New Vic. Now, I would advise that you go through a prospectus to look at the actual entry requirement for each of the various pathways. If you're going to do A-level at New Vic, you should be looking at what the requirements are. English language, English and maths always a necessity, and it's required for all courses, especially on the A-level platform. And we will need 6 in all other subjects just to be able to pursue a program the A-level. But you could also go through the vocational, which is BTech, and the requirement there are a bit something much more lower than going for the A-level pathway. So it's a course that is very, very competitive, knowing fully well that about 60% of the UK population have a problem with their hearing. So it's something that you should think about. And we look forward to having you at New Vic, and we'll be able to guide you through your time here. And hopefully you end up becoming a well-trained radiologist in the future. Thank you.
Okay, next slide, biomedical scientist. Who's taking this one?
Thank you. Hi, everyone. My name is Dauda. And just like my colleague said, when you study science at NUVIC, your ultimate goal is to go into a uni and study for your degree course. And one of the degree courses you study is biomedical science. And when you study biomedical science, you become a biomedical scientist. And on the NHS, there are a range of jobs that you could do. So biomedical scientists carry out a range of lab and scientific tests to support the diagnosis and treatment of diseases. Now, I need to emphasize here that you are really, really important in the diagnosis and treatment of diseases in the hospital. You're not a doctor, but the work you do will really contribute to the doctor coming up with the accurate diagnosis of the disease that the patient comes in with. And that will direct the course of treatment for that disease. And so your job as a biomedical scientist is really, really very important. Collective work of the team that look after patients. So you will work in the operating theater, accident and emergency. And for example, in the accident and emergency, you will work in blood sciences department or test emergency blood transfusions for blood groups. That needs quick piece of work that you will need to do. When someone comes in, for example, had a car accident and he lost so much blood and he needs to be transfused as quickly as possible, you will do a blood group test to make sure that you get the blood group right. Because if you give the wrong type of blood group, you will the person will clearly die. And so your work is really very important. And the work is highly varied, as I said, and practical in nature and analytical. You will usually specialize in one of the specific areas, for example, infectious diseases. You will try to diagnose an infection. If somebody comes in with a cut or an infection internally, you will do your laboratory investigations and analysis to come up with the type of infection, the type of bacteria, fungi, or virus that is infecting the person. As I said earlier on, blood sciences is also one of the tests that you will need to carry out. The other one is cellular sciences, which is to do with like you screening for cancer and so on. Now, in terms of entry requirements, you could come onto biomedical science through either the vocational course or through the A-level. For A-level, you will need Queen Mary, for example, which is one of the universities close to NUVIC. You will need A-levels at AAB grades for you to get in. On the vocational, you will need not less than a DDM for you to get on to biomedical science.
Can I sort of interrupt there, Dauda, please?
Yeah.
So also, please do check the universities, because some universities don't accept vocational, some do. So you've got to check beforehand where you apply, because it is very competitive, isn't it?
Yes, it is. Yeah. So just to wrap up, or to say one final point, Queen Mary, for example, I don't think, but you check, Queen Mary does not accept vocational, but you can check and find out, just like Asha rightly pointed out. Thank you very much.
Okay, I think Marcia is doing chiropractor.
Hello, everybody. My name's Marcia. I'm a biology teacher at NUVIC. So to introduce chiropractors, they tend to work independently. So they develop a one-to-one relationship with their patient. The practitioners, they use their hands to correct musculoskeletal disorders and problems such as back pain, neck pain, shoulder pain, elbow pain, and pain from osteoarthritis. This is an unusual profession in this country in that only 5 universities offer a degree in this, which I've listed below. It's not widely available. This particular treatment isn't widely available on the NHS. It's considered to be an alternative or complementary treatment. So most practitioners work on their own in a private practice. And I've given some examples here of entry criteria. So typically CCC or BCC at A level or DMM in a relevant BTEC. And South Bank University, they offer this course in London, and their entry requirement is DMM, and they require that you show evidence of having a real interest in this this particular course by shadowing a chiropractor for a day or more. Okay.
Thanks, Marcia.
So dietitian, I'll hand over to Sherry Hen, please.
Yeah. So a dietitian. Well, a dietitian is very similar to a nutritionist, but they're a little bit different. Dietitians are regulated by the government, so they have to be registered. You have to go to university to do it. They're usually in the settings of NHS. Sometimes they own their own private clinics. But the thing with dietitians is that they work with both sick and healthy people. So they work with people with a range of disorders to sort out their nutrition and their food conditions. People with, so they usually also work as a multidisciplinary team to treat like complex clinical conditions like diabetes, malnutrition, eating disorders, bowel disorders. And they usually provide quite a lot of advice to caterers to ensure nutritional care. So dietitians are quite important. You can do it directly as a BSc at university, or you can do it as part of a postgraduate. So once you've done a similar degree, for example, you've done biomedical science or you've done biochemistry, then you can do a postgraduate degree in dietetics, something like that. Yeah, so to get onto that, what you would need is 2 or 3 A levels, including chemistry. Oh, I can't see the end of that screen. And you'd need 5 GCSEs at least, grades A to C. Okay, some of the universities that offer it, for example, London Metropolitan University, require an ABB in 3 A levels, and they must include a grade B minimum in biology and chemistry. So there's 2 different routes that you can take. You can go directly into it, or you can go indirectly after you've done your degree.
Great, thanks, Johan.
I think Paulina's doing health.
Yep. Hi everyone, my name is Paulina and I'm the science technician at Nuvik, and I'm going to talk about healthcare scientists. So the general job description is that the staff will help prevent, diagnose and treat a wide range of medical conditions. You may work directly with patients or in a supporting role, and there are main 4 broad areas, which are physiological sciences, life sciences, physical science and biomedical engineering, and clinical bioinformatics. And in physiological sciences, you would assess different parts of the body to diagnose any abnormalities and sometimes providing treatment and care. In life sciences, it's mainly lab work. Physical science and biomedical engineering is about measuring what is happening in the body, devising new ways of diagnosing and treating disease. And clinical bioinformatics is just developing and improving methods for acquiring, storing, and analyzing biological data. So the entry criteria to get into this degree is usually A levels or equivalent. And I've put an example of applied medical sciences at UCL because that's what I did as my degree. And I went through the route of BTEC. So I've got triple distinction start to get into UCL. And but you could also do A levels, and they require AAB, and I would highly recommend doing that because you'll be able to choose what you do for your research. For example, I did proteomics, which is the science of proteins. And after that, I did a postgraduate diploma in clinical nutrition. So as you can see, you can just choose whatever you want if you're not sure yet what's your main interest. Thank you.
Great, thank you, Paulina.
Okay, midwife is next, and that's Becky.
Good morning. My name is Becky Band. I'm one of the chemistry teachers at New Vic. So most people think a midwife just helps a woman give birth, but midwives do more than that. Midwives will support the pregnant woman and her entire family during the pregnancy and then during the birth, but also after the child is born, they will support the family. Most midwives still work in the hospitals, but there's an increase in midwives actually working in the community. They may actually work with the family in their home, supporting the pregnant woman in the home, or sometimes at GP clinics or child centers in the community. At the hospital, you may be working in trying to assess pregnancy. Some pregnancies are high risk, so you do work with the family to identify if it's a high risk pregnancy or not. And then you may be working in neonatal units. You know, some babies are born premature and they need special care. So some midwives work there as well. Now, most of the students we have at New Vic that go on to do midwifery have studied either applied science or health and social care. Either route you will need to get, most universities will only accept DDM, very demanding course. So they do want you to be able to cope with it. So DDM, a few universities will actually accept DMM. Another requirement is that your GCSEs, you must have at least a 4 in English language. So yeah, very interesting.
Sorry, thank you, Becky.
Okay.
Go to the next one.
Okay, Fran, it's a very popular option, this, isn't it, for our students, nursing. Thank you, Fran.
Hello, this is Fran. I work as a chemistry teacher at New Vic. So in nursing, you will make a real difference to people's life. There are 4 different specialties. You could do adult nursing, when you can work with adults of all ages, and you may help them to recover after an accident or if they are suffering from cancer, diabetes, and so on. You could also work in child nursing, where you will need to have a very good understanding of children's behavior in order to communicate with them effectively. You could specialize in learning disability nursing to provide support to people with a learning disability, as well as their families and staff teams, so that you help them live a fulfilling life. And then there is mental health nursing that involves building effective relationships with people who use mental health services and also with their relatives or carers. So, for example, you may need to help them take their medication. The entry criteria really varies depending on the university you want to apply to. You could access the course doing a BTEC course, where normally you will have to achieve distinction, or you could do 2 or 3 A levels, usually with a grade of at least B or A. And that's it from me.
Thank you, Fran.
Okay, so James is doing the podiatrist.
Good morning, all. My name is James. I'm a technician at New Vic College. I hope you're all well, and thanks for attending the virtual day, open day. So podiatry is the range of medicine based around feet and the lower extremities of the human body. You get a lot of different types of patients because it can focus on any part of that. It could be your nails, feet, ankles, lower leg, anything relating to that. It could be trauma, injuries, or infections that you have to deal with. And ultimately diagnose and treat. A couple of examples are on the slide there. So you could deal with people as young as children who are struggling to walk. You could deal with diabetic patients who are struggling with circulation, athletes or anyone who exercises who might have injuries, older people who maybe just struggling to walk. It also involves prevention. You'll be advising patients on how they can prevent getting injured in the first place. The entry requirements for most universities, you would need 3 A-levels or the alternative qualifications, BTEC, HND, whatever it might be, but you would have to study around biological sciences. So that would be important. And an example is there, the University of Brighton.
Thank you, James. We're just going to move on to the next one.
Hey, Samina, thank you.
Hi everyone, my name is Samina. I'm a biology teacher at Newvik. I'm going to talk to you about paramedic. Most people, when they hear the word paramedic, they think, oh, it's just about driving an ambulance. It's a very important job, especially now, as you can imagine, and while we're in the midst of this pandemic. It's very important because not only do you obviously need to be able to get to the patient, you need to be able to assess their situation. What kind of treatment would they need? And especially as we now have such good technological equipment, you need to know which one to use. Your practice might be a life-saving person. There's so many times a person could be very sick, you need to give them CPR or something. They're a very important emergency service, obviously, and they're needed, obviously, on all the time, especially now in the paramedic. It's a very popular life career. You need, for example, at least 2 A-levels required. For example, BBC is most likely. Again, it varies depending on which university you apply to. You can go through a route of vocational, that's BTEC, where you would need a DMM or a DDM. It's very popular career choice, and I've had quite a few students of mine who've used it, and then they have afterwards said that they are really enjoying their life choice.
Thank you, Samina. Okay, and now for our final
Marcel.
career.
Yeah, Marcel will be doing radiographer. Thank you.
Marcel, I think you're on mute.
A radiographer is an allied health professional, meaning they work alongside doctors, typically in a hospital setting. There are 2 types of radiographer: diagnostic and therapy radiographers. So the diagnostic radiographers, what their role is mainly to acquire images and diagnose abnormalities that they see on those images. For example, like X-rays will be used. Therapeutic radiographers, they are used to cure diseases like cancer, for example. Key skills required are caring, patient-focused, probably a talent for technology. The equipment used is of a very high-tech nature. There are PET scans, CT scans, and so forth. A good team player, because not only are you communicating with patients, you also will be communicating with doctors, because an initial diagnosis often comes from the radiographer themselves, and this is passed on to doctors. So excellent communication skills. Also, it's quite a high-pressured role, and so the ability to make rapid decision-making ability is key. Just due to the sheer numbers of people that come through these departments. And when I was speaking to a senior radiographer, another key skill he mentioned was also being comfortable working under pressure. So it's quite a pressured job. But if you enjoy technology, interpreting scans, then this is something for you. Key entry requirements are 2 A-levels, typically in physics or something like biology or chemistry, or you can have an equivalent BTEC, but again, as was previously said, check with the institution. Once you've got a relevant degree, there's also another 2 years on top of that to become a diagnostic radiographer, for example. An alternative route and an interesting route is actually by a degree apprenticeship. So that may interest you. You can actually get an apprenticeship with a hospital and go in that way as well. So these are the options for radiographers, whether it's diagnostic, basically the acquisition of images, or therapy radiographers, the treating of diseases such as cancers and so forth.
Brilliant. Thank you, Marcel. So we're coming to the end of the session now. So I know we've it's gone quite quickly. So thanks everyone for coming. I hope you found this really interesting, just learning a little bit more about potential careers in the NHS and what different courses can lead to. And I hope everyone's found that a little bit inspiring about finding out more about your future and having a think about what you could go into. So just to wrap it up from me, I'm just going to let you know that applications are now open for September 2021. So if you'd like to apply, you can visit our website, newvic.ac.uk/apply. We've got lots of other sessions running today about careers. So if you're interested in anything else or exploring different options, please come along to any of the other sessions that are happening today. Again, if you've got any questions specifically about studying at NUVIC or about our courses, you can visit our online open day website, where we've got lots of videos with teachers talking about courses in depth. And if you have got any questions, you can email us at advice@newvic.ac.uk, or you can also email the email address when you registered for this event. That will come through to us and we can forward it on to relevant members of staff. So thanks everyone for coming to today's session, and goodbye. Bye.
Bye.
Bye.